Hello, everyone. Welcome to the Cardiac Wire Show. My name is Jake Fishman. I'm the host of the show and the editor of the Cardiac Wire, and we have a great episode for you all today. We're going to be diving into the world of cardiology AI, specifically around ECG AI and solutions to address patients who might fall into care gaps within cardiology workflows. And we're going to be speaking with Chris Scotto DiVetta from Tempus. And Chris, welcome to the show.
Yeah, thanks, Jake.
It's great to have you here. To get us started, you have a cool background. We've kind of crossed paths before during the maybe different stops along your career, and it's been a really interesting one to see. Maybe you could share a little bit about yourself and your background and Tempus overall.
Yeah, happy to do that. And, big fan of the Cardiac Wire. I don't know what number subscriber I was on your list, but I think I was in one of the first groups. To your point, we've crossed paths in the past, and I've had a 20-year career in healthcare tech. Started out in as a test engineer, working at GE Healthcare, worked my way up to eventually running a division, the X-ray business, building medical devices. It was sort of along that time frame that computer vision and convolutional neural networks started to be a thing and being applied to medical imaging. And had an opportunity to get an early look at AI and its impact in medicine. Then, as time progressed, continue to be more and more interested in the potential of AI in healthcare. Worked at NVIDIA when they were early thinking about healthcare with Jensen Huang and Kimberly Powell. And that came with the sort of culmination of tools for developers to bring deep learning into medical imaging, but healthcare as a whole. And so a open source project called Monai, another one called Clara, came out of that, which was really exciting times and felt like you were sort of at the early stages of this. I moved on to Quest Diagnostics, which I realized the sort of underappreciated power of lab diagnostics as a patient sensor, the value that they bring. And I got to do that in their advanced diagnostics division, bringing blood-based biomarkers to neurology, or, working with pharma on how to bring companion diagnostics to market. We even built a product for consumer genetics, again, direct to patient and allowing patients to empower their care. And then sort of that combination of med device and AI and then lab diagnostics is sort of what I do here at Tempus AI. Those of you who don't know, Tempus AI has sort of three core business offerings. We do genomic testing, and we have a real world data offering. And then the business that I lead for the company is called applications or AI applications, where we take the data that is sort of generated from those applications and patients in the real world, and we try to find insights from them, and then we turn those into algorithmic diagnostics. And the business model on that is sort of simple. You find some insight, you allow clinicians to order that test. And you provide you go through the regulatory process, you provide, the clinical utility evidence through studies, and then you get reimbursed by payers. And that's sort of one core offering. And then sort of the second area of focus for us is that we ingest patient data in real time, and we contextualize that multimodal patient information to do sort of one of two things: either identify a patient that meets the inclusion-exclusion criteria of a clinical trial, or to identify if someone has fallen off of a guideline-directed care plan, and we notify the clinicians in sort of real time that that's happening. And so that's what I do here at Tempus today.
Awesome. And it's been amazing to see Tempus become what it is. It's a real kind of hero in the world of healthcare AI and precision medicine. So super cool and of course, the things that GE and NVIDIA have done over the years is pretty notable too. So super cool that you've had a front row seat for all of that. Maybe diving in a little bit deeper to the cardiology side of your business. What is Tempus doing in cardiology?
Yeah, cardiology. Many people know Tempus as an oncology company, and that's how it started, and about 10 years ago, somewhere about 6 or 7 years ago, a team led by Dr. Brandon Fornwalt out of Geisinger came to Tempus, and with them they brought a bunch of patient data and some early research that showed that you could find in a normal ECG you could stratify risk and find things that maybe a doctor couldn't see with their eyes in the time series data. That using deep learning techniques, you'd be able to find insight from them. And so, sort of based on that thesis, we've centered our cardiology offering around sort of two core problems. So, if you think about when a patient undergoes disease to when they're treated as the continuum, you have this period before they're diagnosed or undiagnosed diagnostic odyssey phase. And so we have solutions like our ECG AI that focus on helping diagnose patients earlier. And we have another one in what we'll call the diagnose but not treated or not followed up. And we have a product called Tempus Next that came about 2.5 years ago with an acquisition of a company called Empiric, where we codify best practices that a group wants, and we ingest information about the patient and about what's happening with them in the system, and we ensure some follow-up occurs. And it's sort of the combination of those two things, problems to address undiagnosed disease, or if diagnosed, make sure that they get the appropriate follow-up that is our sort of core package. Now, I would be remiss to say that we also have, through the acquisition of Ambry Genetics, which we just closed on about a week or two ago, we have the ability to do genetic testing in cardiology. And so we're excited about bringing that offering into the portfolio.
So what you just said about basically detecting the undiagnosed and then ensuring the diagnosed make it into care pathways is, really interesting. It's seems like, quite a flywheel in terms of just ensuring that all the patients that should be getting care are getting care no matter where they are in the journey. Maybe we could just dive a little bit deeper into the complementary nature of those two solutions, and then I have some follow-ups after that.
Yeah, perfect. I think, look, when I think about Tempus Next, I think about it on sort of two sides of the device. So on the front end of the device, you'd say, hey, I'd like to understand patient context. And so for us, Tempus Next ingests patient data and aggregates it. And this is multimodal patient data. So you're talking about EHR records, both the structured and unstructured clinical progress notes. You're pulling in the time series data on ECG. In some cases, we're able to pull in not only the radiology report, but also the images themselves. And so you've got this like sort of front end aggregation step that Tempus Next does. And then you contextualize or extract the sort of relevant bits from that aggregation. And you're able to, on the front end of, let's say, an ECG AI device, you're able to filter the right patients to the device that are indicated, meet our indications of use. And so that's sort of on the front end. Then with all of these sort of insight-driven diagnostics, there's usually some kind of either confirmatory step or some kind of follow-up step. And what you want is you want to make sure that you're not just, giving them another thing to work on, but you want to help that follow-up does in fact occur. And so it could be as simple as, hey, you'd like to, in our ECG AI AFib device, maybe we flag that you should go put on a patch monitor and be monitored for a week or two at home. To ensure that step in fact happens is like a key handover from the decision that this person might be high risk to in fact they get diagnosed and get worked up. And so those are sort of two ways that Tempus Next sort of complements the software as a medical device that we have in ECG AI.
So I understand that no two hospitals are alike, even if maybe they should be more alike than they are. Are there certain key ways that you see your clients using these Tempus cardiology solutions? And then what, processes or challenges do they have to work through in order to implement AI solutions like this?
Yeah, I think, to your point, in how in the way they want to leverage the device and what it will take for them, like what kind of operation they have around the technology are usually unique. And what's nice about technology is a lot of that can be adapted to what the site and how they want to engage with the information. And so when I think about working with a site, it's definitely a process of here's what the technology can provide, and then there's a bit of configuration on how we might provide the insight. And so as an example, some sites might say, hey, when you alert, I'd like you to alert the physician in the inbox, in the EHR inbox. And that's like a very easy technical solution, and it's the thing we can provide. Others might say, hey, we have a coordinator we'd like this all to run through, who will then manage it on the back end. That's a path that we can go down as well. We've been asked to go direct to patient before. And so each of these things, this sort of last mile adoption is sort of easy to configure in tech and necessary for a site to sort of fully adopt the insights in the workflow. So, to that part of the question, yes, they are all have a little bit of configuration in order to work. I think that helps in the adoption part of the process. I think the other thing that we do with sites is we sort of set a baseline, and often we will, as a part of the connectivity and aggregation, when we're doing like a care gap analysis, we'll start with a retrospective look at how many, like what's the baseline of the care gap at your institution today, and then we give them real time information on whether that's improving or not. And so there's sort of like a gamification of it that I think is helpful in helping the institution deliver or get broad support of the initiative. If you can show, hey, look, we've got a 20% care gap today, and we are going to be able to monitor that and see how we're doing. It's a way to help sort of drive both awareness and rally around the initiatives. And so that's sort of one way we drive adoption. Another specific way folks are using it is they'll often think of this as a health equity solution. And so what they'll realize is that maybe in like a academic medical center, they're not struggling with a care gap, but we've been able to identify a pocket that's, say, in a community setting where there is that. And so they're able to like sort of drive and allocate resources to that area, and we're able to provide that awareness. As an example of that, we had a large academic medical center, do a study with us where they were measuring time to follow-up from an ECG to some kind of follow-up echo. And what they found was that just by sort of instilling Tempus Next into their process, driving awareness to the problem, that they saw something like a 50% drop in time to follow up. And so I think it went from something like 100 days to around like 45 days. And that was super cool, and they were all excited about that. But what is actually more interesting about that study was when they separated sort of black and white populations of patients. What they realized is that there was actually a huge benefit to the black population, and they had actually at the end, all patients were getting the exact same time to follow up. And so it got rid of this sort of inequality that they had been facing in their healthcare system. And a bit of that was being able to shepherd resources to where the biggest contributor to the gap were.
That's amazing. Addressing gaps in care and disparities in care, one solution is it's a big deal. I'm curious, and that was a great example of, I guess, why one system came to you and said, hey, let's explore your solutions around cardiology. Is there a certain situation or list of situations or events that cause health systems to be more likely to reach out and say like, hey, this is the type of solution that we need to look into because we're facing this type of challenge?
Yeah, I think part of it is a lot of institutions want to provide better care, and so they're always they're always out there reading research, trying to identify, new devices or new techniques in order to do that. It's a bit of a funny part of the story is that for a long time before the acquisition of Empiric and before we were addressing this sort of undertreated problem, we would go in with Brandon and team's research, and we would show them the power of this ECG AI to find undiagnosed patients. And I remember the team would come in all excited to share the research, and we'd finally get in front of the right champion, and they weren't getting the same excited reaction from the other side of the table. And I liken that to maybe a situation that many can relate to, where you have a great idea and you want to share it with someone, but that someone has like 10 items on their to-do list, and just like another idea, however great it is like a number 11 item on their to-do list. And that same like look that you get when you share this like genius idea and they come back with this like, I can't take another one, was sort of the effect we were getting with these champions. And so they were believing in it. They were reading the research, and they weren't excited because it was like, delivering care is tough today. And so what we pivoted our approach to, which I think has been helpful, is like, hey, like we know that you have 10 things on your to-do list. How about we address with Tempus Next 5 of those things, right? You've diagnosed, get them to follow up, make sure these patients are more efficiently going through your process. And then we can introduce this like novel and better way to provide care. And I think it's been the sort of combination of those things that have changed the equation and have turned that, hey, we're excited about tech, but we're going to pilot it into, hey, we want to, actually make a move here because, at the minimum, you're going to make my already difficult job easier. And it, I'm also going to be able to provide better care.
Interesting. So like, with your 2 solutions here, but then also the things that you've worked in the past, we've really established that like AI can do a good job on the diagnostics. And then with Tempus Next, I guess I'm learning that AI can do a good job making sure that the folks who have been diagnosed or at least flagged as at risk can be kept in care pathways and treated with appropriate care. When you look into the future about what healthcare AI can do, or how do you see it impacting patient journeys basically across the spectrum?
Yeah, you bring up a good point. I don't want to miss the sort of value that AI is playing in this, or I want to be maybe more specific. So a large part of the data of a patient is unstructured. And even if it is structured, it's often not standardized. So you have an unstructured and a not standardized problem. And so being able to leverage AI in that ability to structure the unstructured, I think has never been easier. Like 4 years ago, it was starting to be possible. In the last 2 years, it's been like very easy to do, particularly with the advancement of generative AI and LLMs. And so now that you're able to like sort of structure the unstructured information, and today we're talking about maybe progress notes and clinical notes, but even that early AI that I discussed, using deep learning to analyze images and to better structure the information from those. It's sort of the combination of all of this AI advancement that has created what I would call like a higher resolution sensor on the patient, right? So now you've got much higher fidelity information coming from the images. You've got much more high fidelity information coming through the textual data that's being, and if you're able to get high resolution data, extract the relevant pieces, which if anybody's using ChatGPT today knows how good LLMs are at sort of summarizing the relevant pieces of a complex data set, you can start to approximate what folks have often called like a digital twin of a patient. And so I'm very excited about like one day there's like a longitudinal digital twin of a patient. And now, based on many of us starting to institutions, companies like Tempus, being able to store this data, de-identify, store this data, and be able to compare, which AI is also good at, this patient versus patients like them in the past, you can start to then maybe simulate a treatment plan and what's going to happen. Hey, you know, overall survival. Maybe you're also looking at like toxicity risks, and all of these things feel closer than they've ever felt before. And so I'm very excited about sort of the practical application of AI to just do sort of bread and butter tasks that are occurring and help people provide more individualized care. But I do think that there's this world where you have this longitudinal digital twin of a patient. You're able to compare them against patients before them and sort of predict what might happen with them. It just feels like we've never been closer to that.
Today we have that ECG AI detection and AI-based care pathway management, and tomorrow we have digital twin diagnostics. It's neat to be in the middle of. Chris, thanks so much for coming on. I learned a lot. It's really cool to see what Tempus is doing in the world of cardiology, and knowing what Tempus is capable of. The world of cardiology is lucky to have you in it. So thanks so much. For the folks who are watching, I'm sure you learned a thing or two. Also, go ahead and, if what Chris described in terms of the reasons that hospitals reach out to Tempus for diagnostics or care pathway management, if what he described sounds like what's going on in your institution, give Chris and his team a call at Tempus, and I'll catch you next time.
Thanks, Jake.